Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. Cece, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Anna Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. Cece, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama, and our co-host.
I'm Anna Kate, your medical mystery overachiever and discovery liaison. And we're back with a mini-sode, and we're going to talk about something that is not so near and dear to my heart because it's a pain, but we're going to talk about Lyme.
Yes, and its best friend.
Bartonella.
Yes.
And how they're different.
And how they're different, and also how they're the same, or how they can present the same. But can we clarify something to start with, please?
Sure.
Does Lyme, yay or nay, have an S at the end of it?
No.
So it is Lyme disease. I have so many. I love you guys. You know I love you, but I have so many people. I mean, even just my mom will still say it with an S, and so many patients. And I have Lyme's, and I'm like, Lyme? Yes, Lyme disease. Lyme. There's no S.
Yeah, I know somebody that's got Lyme's.
Yeah.
I'm like, what do they make margaritas out of them?
Right. Can we just take off the S, and you nailed it? Okay.
It's
no
not
judgment,
possessive.
but yes, there is no S. So that's our first most important rule.
And to clarify even further, technical Lyme disease is only Borrelia burgdorfri.
Yes.
That's what is technically Lyme disease.
So this is actually a very good point that I think people who aren't medically trained don't think about. Maybe you know, but you don't think about. So when we have a disease is a name, right? So the disease is Lyme disease. However, that disease is caused by a bacteria. Mm-hmm. That bacteria is Borrelia burgdorfri. It's the same thing like if anyone's ever had mononucleosis. That is the name of a bunch of symptoms and a quote illness or disease that you have that is caused by Epstein-Barr virus. Mm-hmm. So that's a very good differentiation factor.
Yes.
Is because there, in terms of standards of testing, there are different methods of testing that will qualify you in terms of the CDC as being diagnosed with Lyme disease or not. And so in practice, we kind of have to be careful of our wording of saying, okay, yes, you have Lyme disease. Is it according to our government, or is it according to kind of the rest of the world? Or do you have a Borrelia burgdorfri infection? So just know that the difference between the name of the disease and the bacteria that causes it. But yes, very important that Borrelia burgdorfri is that bad boy. Yep. And his best friend tends to be Bartonellas, Bartonella. But even with Bartonella, there's multiple strains of Bartonella. Just like with Borrelia burgdorfri, there are numerous strains of Borrelias. So really when we say Bartonella, I tend to mean Bartonella Henceley because there are different siblings, Bartonella vinceoni, Bartonella quintana. And, you know, so it's just important to know.
Beautiful Italian names, yes. And it's not like living on the Italian coast.
No. And so it's important to know that there are numerous strains of these bacteria. When someone says I have Bartonella, okay, there's tons of strains of Bartonella, which one? But to dive in, one of the questions that I was asked was, what can Lyme, so I should say, what should a Borrelia burgdorfri infection look like? What can a Bartonella infection look like that people might not know about, like less common symptoms? And so obviously my brain goes a little bit further and says, okay, well, first we have to know what the common symptoms are.
Right. So on the common symptoms, because they both share common symptoms. So y'all have heard me say it before. And if you've been around me for more, any of my chronically ill story, I always say I have Lyme disease with 18 co-infections. So all of these brothers and sisters and all the things, all the different things, they all share very similar symptoms. So I have the special case of the aches and the pains and the fatigue and all of that, I don't know exactly where they come from.
Right.
Which one.
Right.
So I do
And
know
it can be
that,
very hard
yeah.
to differentiate, but that's another good word that I want to talk about for a second is co-infections. People love the word co-infections, and it is at the end of the day important to know that these co-infections can be, you can get those at different places in life. They
Yep.
can be transmitted differently. It does not mean that someone who has Lyme disease has all these other infections as well. The term co-infections just means that we tend to find them together. It is common to find them together, but it doesn't mean that it's mandatory.
Right.
And they're also, another important factor is that they are all very different. Some of what people call co-infections are completely different bacterial strains that have nothing to do with Borrelia.
Right.
Some of them are parasitic organisms. Some of them are viruses. So it's important to differentiate within that group of co-infection, and just know that that can mean a multitude of
Right.
things. And it's not the bacteria that causes Lyme disease, and sometimes it's not a bacteria in itself at all. If we're sticking with Lyme for a second, I would say there are commonalities between patients. All I can speak of it is my experience, right, in my patients that I see and what I went through personally. But what I see in my patients with chronic Lyme, right? So we're not talking about acute, yes, you got bit by a tick and you get flu-like symptoms and a fever, like
Right.
that just doesn't happen. So we're not talking about that instance. We're talking about chronic, on the chronic front. And on the chronic front, the commonality for me with patients is absolute fatigue, brain fog. Now, brain fog is a word I think that gets, it's kind of like anxiety. It gets placed on and can mean many different things to many different patients. But brain fog, some sort of cognitive feeling of decline, which can look different for some patients. It's word retrieval issues, memory loss.
And on the patient side, it works on the inside, but it doesn't connect to your mouth to come out the other side.
Yes.
That's where the disconnect happens. Not that you're not thinking it. The cognition is there on the inside, but the connection to get it back out your mouth to where it makes sense to other people that are trying to listen to you, that's where the disconnect. And that was one of my symptoms with this as well. It was a big deal of.
So that, right, yes, that in terms of that brain fog and disconnectedness, then there is internally more so like the word retrieval and memory loss, and just not feeling as quick or as sharp, and tasks are starting to become harder. That is a commonality. And then for Lyme, I say this to patients, something physical. I know that's so general, but something physical, because it's not just joint pain.
Yeah.
But I will have always something physical when it comes to Lyme. It can be joint pain. It can be muscle aches. It can be joints that are locking or stiff. It can be more whole body fluey, achy type of feelings. It can be random joints that swell up. I had a 6-year-old a couple years ago who had a knee, like he was fatigued, and then he had a knee that would just swell up to the size of a softball, and he couldn't bear weight on it. And that was it. And they had been to oncology and hematology and all these other places. Nobody could figure it out. It was stinking Lyme. We treated him. Never happened again. But that there's usually something physical, but it can look so different in patients. And the I would say that the pain aspect on some front is common because of the shape of the bacteria.
Yeah.
Because it's shaped like a spirochete, it digs, and so it can destroy our cartilage, which then obviously can create more joint pain.
So they're shaped like little screws. For those of you that don't know what a spirochete is, they're shaped like a spiral. And when you make them mad by doing something that causes them to go and hide, they screw into other places in the body, which is why his was typically isolated to his knee, but if it had been left unaddressed for a long period of time, it could have gone into his hip. It could have traveled. Can they go in the bloodstream? And then they travel to shoulders and brain and all the fun stuff. And so that's why my brain is like Swiss cheese, because I went so long with, So I got in the brain. I do feel that way. I do feel that my insides are like I just have holes everywhere.
And then that leads to more inflammation. So then you get symptoms from those inflammatory responses. And then eventually, when someone who has had it for so long, now you get disruptions in, and not even for that long, it could be for a stinking month, disruptions in hormones. And some patients can have more shortness of breath and more cardiovascular symptoms, and changes in menstrual cycles. I mean, the list from the commonality, which again I would say is cognitive deficit and some sort of physical pain usually, and fatigue.
Those are the three.
Yes, it just branches from there, because it depends on your immune system. It depends what you are taking. If you're taking certain things that are suppressing that agent a little bit, depends on your antibodies. It depends on how strong your natural killer cells are and how you are attacking it right here, right now, what other things you have going on. And so then it spirals and spirals. But one point that I do want to make is that a huge difference that I see between Lyme and Bartonella is that Lyme is way more autoimmune activating. I don't see Bartonella infections turning on an ANA or turning on antinuclear antibodies, or antibodies that basically say that your body is attacking its own tissue for some reason. And this can lead to diagnoses such as lupus or Sjogren's. I take that information, I say, okay, what's the body attacking? Like, let's figure that out. And I will see Lyme as a culprit to turning that autoimmune reactivity on. I don't so much see it with Bartonella. Even patients who have like chronic Crohn's or IBS, symptoms like that, or disorders like that, where the Borrelia burgdorfri bacteria is just, it's wildly activating. And it picks on our genetics and it amplifies things that we're already going through. And it allows for other bacteria to wake up, or other viruses to wake up that aren't causing a problem. And that's where I see the symptoms start to spiral.
So it's a catalyst.
It's a catalyst, exactly. It's a catalyst. And it's not to say things like those other 18 co-infections that you have, those all then play a part in the symptoms. I just don't see the autoimmune activation that I see with Lyme with those other guys. I see those other guys more as like followers that
here for the party,
and I'm going to wreak havoc and cause you all the symptoms while I do, and all the neuroinflammation and etc. that you have to work equally as hard to get rid of. But they're here for the party. And in the instance of someone who has Lyme specifically and all those co-infections, oftentimes I'll find that Lyme is the one. That dude was a party starter.
He's the instigator.
He's
also a great imitator.
Yes.
So it could pose as other things and not be those other things at all, and be Lyme disease.
Yes, 100%. And I will see that a lot with autoimmune diseases. People are diagnosed with tons of autoimmune diseases, or general like fibromyalgia, just general diseases where it's this blanket term. And it can really, it can present exactly as a criteria that will fit for these other situations and not be that at all, which makes it tough to find sometimes. But on the flip side, then Bartonellers is a little bit different. So Bartonella, we touched on this in a past episode a little bit, but Bartonella Henceley, I should say, originated as cat scratch disease. So cats can carry it, but it is vector borne as well. So fleas, flies, ticks, mosquitoes all carry it, which Lyme obviously as well. The Lyme bacteria can be transmitted via vectors. So that's why they are closely linked. They are in no world the same, but that's why they are closely linked, because they can be transmitted similarly. So Bartonella is very different in that it chills out in the central nervous system. It likes the central nervous system. When we create antibodies, we start attacking the central nervous system by default, because that's where the bacteria is hanging out and replicating. And so my commonalities with Bartonella in terms of Lyme will be fatigue, increased fatigue. And then outside of that, it actually is a very different acting bacteria that I will find more of our POTS-like symptoms stemming from Bartonella versus Lyme, which Lyme can enhance. But because it targets the central nervous system, it really can inhibit our autonomic nervous system and how what our blood pressure is doing, what our heart rate is doing.
Yes.
It can follow the nerve patterns and cause weird burning, tingling, vibrating sensations, numbness, weakness. Some patients will tell me they feel like their feet are on fire. There's ants crawling on their skin. Their hair is alive. Ringing in the ears, very, very common. So when people start using certain words like, yeah, when I get up in the morning, my feet are just, they're burning and it feels like I'm walking on glass. My ears are like, oh,
Yeah. So
Bartonella.
maybe it's just me and maybe my symptoms, but have you ever jumped off of something like when you were a little kid and you hit the ground so hard and your feet kind of burned?
Hate that feeling. Yes.
That's what Bartonella feels like.
Yeah.
Or for me,
feeling.
It was like stepping on Legos every time I stood up.
Mhm.
And it wasn't always in the same spot, but I just could not get my feet to like I get these, and I still get them now, like pressure bruises,
Mhm.
like an egg. Like if I mean, it'll be like this big old goose egg if I've leaned on something
Yep.
for too long. It just, and I don't know what that is. If that's one of the things that I currently have, or just a remnant of how my body responds. Because we'll talk about this in another episode that I put the kibosh on Bartonella. So and Borrelia burgdorfri, we switched those off, but it's different because the fatigue is the same.
Yeah,
so,
fatigue overlaps for
yeah,
sure.
It just, but and it's a weird fatigue. I mean, it's like just being, it's like having the worst flu that you've ever had, kind of achy, tired.
Yeah,
and like going to an all-nighter and just being all up, not up all night and being delirious. It's that kind of fatigue.
When you've had both, you can differentiate Lyme fatigue from Bartonella fatigue. It's very hard to explain to a person who's not going through them, but you nailed that. Bartonella fatigue is it's like a fluey, like you're about to get sick, but not type of fatigue.
Right.
Lyme is more of a dissociation fatigue almost. But it also varies in people. So
if you've had it, you know exactly what we're talking about. If you haven't had it, just think about the worst flu that you've ever had and those body aches and that just super tired feeling, and then stay up all night and then try to get caught up, and you can't. Any amount of sleep does not help.
Right. Where I think Lyme is more just like you sit and you cannot. I don't know how to. I still don't even know how to put it in words. Like it's what I used to say is that my head was 500 miles from my body.
Mm-hmm.
That it was so disconnected that my body would want to do things, but my brain and my head could not. Mm-hmm. And I was and you're just tired all the time, and you're managing energy, and you plummet really easily. But another thing with Bartonella that I think is important to know is anxiety. Anxiety and depression are very, very common with my Bartonella patients and heightened anxiety or patients will be like, I never had anxiety before in my life. And now all of a sudden, all these situations make me anxious.
Can't watch scary movies anymore. I used to watch a show that I loved. I absolutely loved it. And I had to quit watching it because it would get my heart rate up.
Exactly.
And I'm like, dang it.
And it's because that goes back to that bacteria hanging out in our central nervous system. And now it's altering our neurotransmitters and those chemicals that are being received in the brain. And that fluctuation then causes an increase in anxiety, where then we're having more of those heart palpitations. We're feeling more anxious. So that is a difference too that I'll see between Bartonella and Lyme, but they can mimic, they can overlap. And sometimes it can be some of the hardest questions I get are like, well, what's the symptom coming from? I'm like, well, you have 6 different infections going on. And so it's hard to pinpoint, but there are definite commonalities. And then there are definite distinctive factors, such as the burning of the feet or the ants crawling on the skin versus more of a true joint pain is over on the Lyme side. That, hopefully if you are experiencing any of those, that differentiation makes sense. But I also don't think it's up to the patient to have to know that. If you're suffering from these things, the provider should be the one to be able to decipher those symptoms and be like, hey, and I'll tell my patient, I'm like, wow, you sound very Bartonella. And I usually don't like to say these things because I like to see it on paper and test you, but this sounds very Bartonella. And 99% of the time when I say that, it comes back as you learn. And so I love to educate and for patients to have, or people to have the basics and the baseline of how these things can be different. But at the end of the day, you should have a provider who knows those differences and help you navigate them.
And track your symptoms. I think that when we're in the pain, we think that we'll remember it and we will know to say that thing that we feel, whether it's the burning feet or the ants or just, hey, I slept and I had so much water and I was eating all the things that I need to eat and I just am still exhausted, like just slap on the floor, exhausted. So write those things down because those are clues to her of how to differentiate from whatever bacterial or viral load that may be causing these things, or a parasite or whatever else is going on, or a combination of the things. But you won't remember. I'm telling you, you won't remember. You won't remember. And also the good thing that we will also talk about, the option to kind of help turn some of these things off is when she asked me how I'm feeling as, practitioner and patient, provider and patient, that I'm like, I feel better. I don't feel like I once did. I still have weird random things, but I don't feel as overtaxed and exhausted as I did when all of this other stuff was turned on.
Yeah. And also a good provider will keep note of exactly what you're feeling. Like I ask so many questions. I'll apologize to new patients. I'll be like, I'm sorry, I'm almost done interrogating you. But it really does help me because I create a list of everything that you told me, no matter how ridiculous it sounds. Like I write everything down because as we progress forward, I want us to be able to go back to that list and be like, hey, you told me one time that, or last time we met, that your left pinky toe feels like you are walking on glass every single time you put pressure on it. How is that doing? And I don't want to just ask a blanket term of how are you doing? I want to know symptom by symptom. What are we crossing off? What do we, how are we progressing forward? And oftentimes that's very validating because they'll be like, oh, I forgot. Yeah, no, that hasn't happened at all. Like that's gone. But it takes me prompting that and reminding, because someone who has been so used to having 110 symptoms, it can be very hard to realize that certain ones are going away because you're still experiencing other ones. So all that to say, Lyme and Bartonellas are different species, different bacteria.
They're like the Bash brothers.
They are.
They hang out together.
Yeah, but they do hang out. They're little besties. They can wreak havoc together, but at the end of the day, they are very different bacteria that can cause very differing symptoms. So we hope it's been helpful. Our next episode, little mini-sode, should be equally as helpful in terms of a specific treatment for
we're going to beat up the Bash brothers.
Yeah, we're going to do it. So stay tuned, hang out with us as we continue through these mini-sodes. And until next time, let's discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The host, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.